terms of the three legs of the stool, this is the easiest one, and they make the other two so much better, so much easier, so much more manageable. This episode on the RD Mind focuses on medication. Again, like I said in the previous episode, medication is one of the three legs of the stool of meeting your challenges. I know that for a lot of folks, medication is a bad idea. I don't take Tylenol, pain medication for a headache. Okay, so I respect that completely, but in this case, you're robbing yourself of something that really helps. It's one of the legs of the stool. All three together of medication and partnering and strategies, that's how everybody meets their challenges of their RD mind. To do it without medication, it's just really difficult. And I find that when I work with people who choose not to take a medication, they struggle and they typically find the strategies which they learn here in my office, they don't do them. It's just so much harder to do them without medication. Now, other people, and I'll talk a little more about this later in the episode, other people use medication only when they want to or need to. They don't take it every morning and make it work all day. They target. Their life works that way for them. They put their glasses on. I'll talk about that in a second. So medication is something that, again, you work out with your doctor. I always have ideas with my patients and talk to them about them, but I say, go talk to your provider, figure it out together. Here are some ideas and some strategies around medication. Medication like Adderall and Ritalin and all the different things that are like them, but those are the two basic families of stimulants that work best. Anyway, medication like Adderall temporarily increases regulation of neurological activity. Like I said, RD Mind is a regulation difference. So the medication temporarily increases regulation of your brain activity, your neurological activity, which results in fewer thoughts per second, therefore it's easier to focus, less emotion in the moment, which may be advantageous for emotional management, especially in relationships. And then lastly, reduced activity level, which means you can sit through a task you want to sit through. Like people tell me, oh my goodness, like a student, I can suddenly sit through a lecture I never could before, or at least I wasn't even close to being present, even if I was sitting there. So that combination of reduced thoughts per second, less emotion in the moment, and lowered activity level just makes a whole lot of life easier, manageable. We're looking here for manageable. That's what medication does. And it's really advantageous when people use it. I liken it to finding a pair of glasses for the brain. So obviously, I am wearing glasses, and genetically, my eyes need glasses. I could choose not to wear them. Sometimes I do, like exercising and other things. I just don't want to have my glasses on, and I don't need them. Having a pair of glasses for the brain in terms of medication for the RD mind is that because it's biologically driven that you have an RD mind, then you can choose to put glasses on. And when you do, like right now, I can see everything here in my office very clearly. When you put glasses on your brain in terms of the RD mind and something like Adderall, you, for the period of time that that medication works, you have fewer thoughts per second, less emotion, and reduced activity level. And that can be very helpful, just like my glasses are helpful. So that analogy works pretty doggone well, except for the fact that I choose to take off my glasses, but medication typically goes into your system and it lasts for 4 hours or 8 hours or 12 hours. So that's different. There is one kind of medication that's on a patch, so you could take it off, and a couple hours later it's out of your system, but most medications are just pill form, capsule form. So Anyway, glasses for the brain. Just remember that. Glasses for the brain medication, that's what it is. Finally, in this episode, briefly, because there's a lot to talk about here, but mostly you want to talk about it with your medical provider. So basically, you want to find the right medication at the right dose and the right timing. That's what you do. You find initially, let's say you find Adderall and it works for you. Then you want to find the right dose. I think for adults it's around 20 milligrams. It typically is 20 milligrams. And then you want to figure out, well, it only lasts 4 hours, so I only want it. I only want glasses for my brain for 4 hours, so I take it when I need it every day. Or, no, you want like 8 hours to have glasses on your brain, so to speak, so you take it at 7 o'clock in the morning, and it works then until, 3 o'clock in the afternoon, and then it fades away. Because you've taken a second dose after the 4 hours. You've taken that at 11 a.m. There's also Adderall XR as an example. There's Ritalin products similarly, but let's say Adderall XR, that lasts maybe 6 or 8 hours. Maybe you just take one of those, and that's glasses for your brain plenty. Or sometimes people take the Adderall XR in the morning, let's say 7 o'clock, by 3 p.m. it's fading away or faded away already, and they don't take anything else. Or sometimes they take a second Adderall XR at whatever dose your doctor, your medical provider works out with you. Sometimes people take a short-acting Adderall. That's the 4-hour kind. That's what they do almost every day. Or sometimes they do take the second and sometimes they don't. Another option, my personal favorite, is a medication called Vyvanse, because it's basically a really long-acting Adderall. Go talk to your doctor or scientist, that's exactly how that works, but it's a really long-acting Adderall. And you take it an hour later, it's working for you, and it works for 10 or 11, 10 hours, pretty smoothly. There's no ups and downs, just smooth, it's working for you. And then, 10 hours later, it fades away. So, 12 hours from start to finish. Some people take a low dose of second Vyvanse in the afternoon. Some people take an Adderall later on if they need to. Again, what I'm talking about, you work it out with your medical provider. I'm talking about the right medication at the right dose and the right timing. All three matter in terms of having the glasses on your brain that you want. All three matter, and you work that out with your doctor provider. So, again, with medications, they're typically of a certain acting length. Like Adderall is short-acting, 4 hours. Adderall XR is long-acting, 6 or 8 hours, and Vyvanse is really long-acting, 10 or 12 hours. That's what I want you to know from this episode. Glasses for your brain, one of the 3 legs of the stool. It really works. It's safe. It's safe. It's safe. Just work it out with your medical provider. They know what they're doing, and you'll find it really effective. I mean, it's also the easy button. Devising, developing, adopting strategies, harder. Not too hard, but harder. I mean, a pill is a pill. Like my glasses, I just put them on. So in terms of the 3 legs of the stool, this is the easiest one, and they make the other 2 so much better, so much easier, so much more manageable. That's what I'm looking for in my patients. They have a medication, and they have a regime or strategy of how to use it, and everything else in life is so much more manageable than it was before. All 3 legs of the stool, including medication. So I hope this has been helpful, because you deserve it and you are awesome.